Quick intro to Green Energy Consumers Alliance. For those of you who might be unfamiliar with us, we are a nonprofit organization based in Massachusetts and Rhode Island, and our mission is to empower consumers and communities to speed a just transition to a zero carbon world. That's a lot of words, but basically what we do is we run a series of programs and services that help people access various clean energy technologies. One of those programs is called Drive Green, where we talk about electric vehicles and make sure people have answers to their questions about charging and road trips and batteries and incentives and all that. But we also do public policy advocacy work at the state level, both in the transportation sector, but also other clean energy sectors. So we spend a lot of time talking about electric vehicles and infrastructure in the climate context, but today we're excited to talk about it in the public health context. We will be joined today by three speakers. I will have Dan introduce himself and then Alyssa.
Hi, everyone. My name is Dan Fitzgerald. I use he, him pronouns. I work with the American Lung Association. I oversee our mission impact work in Rhode Island and Massachusetts, including our advocacy and state public policy. I look forward to talking about some of our research on the topic. Thanks for having me.
Hello, everyone. My name is Alyssa Benelfi Ramos. I use she, hers pronouns. I'm the Chief of Policy at the Black Economic Council of Massachusetts, or BECMA for short. We do statewide advocacy related to the racial wealth gap, and I'm excited to talk about EVs and public health today because obviously promoting EVs and clean energy is part of our public policy priorities, and my background's in public health, so this is a merging of two of my interests.
We are very glad that you're here. And oh, you're here. Ezra, go ahead, introduce yourself.
I'm Ezra Cohen. I'm a pediatrician at BMC. I also do pediatric rheumatology. I take care of kids primarily in an urban setting and drive. Our household has two EVs, so I feel very passionately about this subject, and I firsthand see a lot of the impact that environmental policies have on kids' health.
And you're calling in from BMC, I see. So I'm very extra grateful that you're here and that you got here so early. I was worried you wouldn't be here in time.
No. Good.
And then everybody, sorry. My name's Anna Vanderspeck. I'm our electric vehicle program director here at Green Energy Consumers. But this presentation today is broken up into a couple of sections. We will start with the public health impacts of gas and diesel vehicles. Then we'll talk about the relative pollution impacts of electric vehicles versus gas and internal combustion engines. And then we'll round it out with a sort of vision of what the future could look like in terms of public health in an electrified future. And then we'll, again, have plenty of time for Q&A and discussion. I will stress that we talk about the greenhouse gas emission impacts of EVs all the time. And if you're interested in that, we've got lots of webinars and slides for you. But today, we're really going to hone in on public health. So I will go ahead and get us started by turning the mic over to Ezra.
That's great. So gas and diesel vehicles have a lot of negative impacts, and those impacts disproportionately affect children and the elderly, as you might expect. So when you burn diesel and gasoline, it generates very fine particles. They're all different sizes, but they're classified into the ones that have the biggest health impacts are classified into particulate matter 2.5 and ultrafine particles. And you can see that basically, depending on the dimensions of the particle, they penetrate more deeply into the lungs. This is sort of logical. The lungs get smaller and smaller as they branch. And the reason they get smaller and smaller is so that the air sacs, the alveoli at the very, very end are interfacing with tiny little blood vessels called capillaries so that they can seamlessly transfer oxygen and carbon dioxide into our blood. So very fine particles you've heard probably of problems with or may have with talc and silica and other things that are very, very fine can cause the biggest problems. And these combustion particles can reach all the way into the air sacs, which are absolutely crucial for exchanging oxygen and carbon dioxide in the lungs. We know for sure that these products can make asthma worse in kids, and certainly there's a much higher rate of asthma in urban environments. I'm not an expert in asthma, but that is probably due to a lot of reasons. But one big part of it is probably the proximity to traffic and pollution and things like that. And we know in the elderly, in a condition called COPD, which has some similarities to asthma, that also can get worse. And then likewise, the kind of chronic inflammation that's caused by exposure to this particulate matter can increase the risk of infections. You can go to the next slide. So there are other products of gas and diesel combustion that are problematic. Nitrogen oxides are a pollutant that is linked to worsened lung function in a lot of large epidemiologic studies. Polycyclic aromatic hydrocarbons. I don't know if you guys have ever been told not to eat bread that's extremely burned, but those are present in anything that's been really combusted, kind of to the end point of combustion. And this might be going a little deeper than people are interested, but basically DNA is stacked like this, and these molecules are also kind of flat stacks or flat shapes, and they can go in between DNA. And then when your body goes around and tries to replicate the DNA like it's doing all the time, it will make an error because you have something sticking out of it that is making the DNA look like it's a different shape. And as a result of that, you get mutations, and most of the time your body repairs those mutations, and sometimes it doesn't, and sometimes those mutations lead to cancer. So that's a very obvious progression that you can literally see what it's doing in the DNA and how it causes a clinical disease. And kids concentrate a lot of these things in their body more so than adults because they're developing, so they're internalizing a lot more into their body that's required for growth. They don't have the same defense mechanisms. They take more air per pound. Sorry, I have a little typo there in the next line, but both of these compounds have been associated with similar things as before: preterm birth in pregnant moms, a lot of neurodevelopmental disorders, and cancers, as I mentioned above, and elderly for slightly different reasons, but also because of their defense mechanisms, are also at high risk for exposure to both these things. Sorry, so the next slide, and I think next participant.
Oh, I thought this was you, Ezra, but maybe it's not. Alyssa, is this you?
Wait, the next one you want to show me?
The slide hasn't changed yet.
It hasn't changed, yeah.
That's very
No,
weird.
that is,
It has on my end. How about now?
I can see it now. This actually might be me I don't know, actually, Les, is this me or you?
This is you. I have a map.
Okay. Yeah. So basically, the best remedies are, there are a lot of potential remedies, but basically anything that reduces the concentration of these things in the air. So basically, regulating the air concentrations of the nitrogen oxides and the particulate matter. Greening, meaning a lot, our trees and vegetation do a lot to clean the air. Not just processing greenhouse gases, but doing a lot with particulate matter as well. Filters at school, so that even if the outside environment has a lot of this particulate matter, they're just getting less exposure, sort of per minute per day. We've all gotten alerts on our phones when the air quality is poor to stay indoors. And just zoning policies so that roads are not right next to places where people live, highways, schools. And then, of course, the most obvious, which is at the top, is transitioning to cleaner technologies. And those are electric and also the ultra low sulfur diesel is mentioned for trucks and other things.
Thanks, Ezra. I think the points you made about zoning policies are a good transition into Alyssa's part of the presentation, which is all about the disproportionate impacts and the decades of policy decisions that have gotten us to this point.
Hello, everyone, and I'm excited to nerd out about a real public health issue that I'm very concerned about and also share some information folks might have not known. And thank you to Dr. Cohen for providing that background on how it affects our bodies. I wanted to provide this map that talks about the particulate matter for 2.5 in particular. That's a little bit of a weird way to say that. Exposure to diesel particulate pollution in Massachusetts. So this map, as you see, is showing the concentration annually of PM 2.5. And you'll see it's near all these major cities, the Boston area, Greater Boston, Lowell, Brockton, New Bedford, Worcester, Springfield. And the lines that you see on this map are the average truck traffic. So it makes sense that we have truck routes that are going directly into major cities. But as you see, that's creating a high level of pollution in specific communities. And so part of what I want to do today is kind of unpack why these truck routes and major roadways are near and in cities and near communities of color and how that impacts the health of residents in those areas. Next slide, please. So this is a map of Greater Boston. It's kind of been modernized to show what the city looked like in the past and what it looks like now. And what I want to say about this is we all don't experience the harms of these pollutants the same. And we don't experience this equally. And this is because of historic policies like redlining and highway placement. Communities of color are far more likely to live next to high traffic corridors and bus depots. It actually goes back to how these communities were mapped out in the 1930s. Boston, along with most major cities, a lot of major cities, had been literally mapped out by the Federal Home Owners Loan Corporation, who categorized neighborhoods by investment desirability based largely on race and also immigration patterns. So this practice was called redlining and literally graded neighborhoods by color, like took a red pen marker on the map. And neighborhoods that were red and yellow were deemed undesirable, hazardous, and declining, while blue and green were the best and desirable. And obviously this was by racial lines. And before I move on, I just want to say I live in Boston now, and I used to live in Boston in a different neighborhood. I lived in Eastie, which is in the top right-hand corner of this map. It's that kind of red jutting out area in the top right-hand corner. And when I lived in Eastie, I could see the airport from my bedroom window, and I can feel the vibration from the planes as they were coming into land. If I left my apartment and drove down the street and made a left and made a right, that was the ramp to get on 93 to like go towards the tunnel to come into Boston. If I walked 7 minutes away, that was the Wood Island train station to get on the blue line to go further into the city, and also I could hear the ships. If I did like a 10-minute walk in one direction, there's the port with all those huge, huge ships that bigger than I ever thought possible, were coming to bring, supplies and whatever else happens at the ports. So to think about that level of exposure to so many different things is folks' reality. And East Boston is a community that, has a lot of immigrants from Hispanic countries, Latin America, Central America, South America, as well as, Black people and European immigrants. There's just a lot of immigrants of different backgrounds there. And so think about just kind of what that looks like for all of that to be centered in one neighborhood. Not every neighborhood is like that, but just wanted to give a personal example of what it looks like to experience many pollutants at once. Next slide, please. So in addition to redlining, I also want to speak a little bit more about the creation of highways starting in the mid-1950s and onward. Highways here and around the country and in Massachusetts were a strategy used to prevent integration. So basically, when pushback was occurring about redlining and racialized zoning, folks in power realized that creating highways around these racially zoned areas was another way to prevent integration and create physical barriers between communities of color and white neighborhoods. In the present day, just factually speaking, Boston is still a majority minority city. And these communities that you see were red are still areas where most communities of color and immigrants currently live. And Boston is the 11th most segregated city in the country. And I think that speaks to, how folks kind of get boxed in based on where they're able to live. So folks end up marginalized by urban segregation in US cities like Boston. And these communities, like we said already, are located near freight centers and heavily traveled roadways and can lack access to or struggle to obtain the resources to adapt to or move away from air pollution, diesel pollution, and other climate-related harms. These same communities also experience systemic inequities, meaning that they're facing higher rates of asthma, diabetes, heart disease. So pollution makes existing health problems worse. And also due to these structural inequities, in addition to the air pollution and diesel pollution, we have an older housing stock here in Boston that contributes to respiratory issues. You know, folks have lower wealth and income. We have a stark racial wealth gap here in Massachusetts. That's the work that my organization tries to address. We have food deserts and food swamps and food apartheid. Please look up those terms if they're newer to you. We have less access to quality medical care. If you are a person of color living in Boston, and that might be surprising to folks, like, no, we have the best hospitals. Doesn't mean all the folks who live here, communities of color and immigrants, are able to access that level of care. And folks are dealing with toxic and chronic stress that has an impact on the body. These communities often have less green space, less tree cover, fewer recreational spaces, you know, and less built environment. And there are safety considerations there as well. So to kind of wrap up this piece of me nerding out about the social determinants of health, the result is a life expectancy gap. So in Boston, some neighborhoods of color have lifespans 20 to 30 years shorter than the wealthier, whiter neighborhoods. And there's a whole example about Mass Ave, one side of Mass Ave. Folks are living 30 years longer on the Back Bay side than on the Roxbury side and further down. And vehicle pollution is a part of that story. I would even argue a major part that often gets overlooked. Last slide. So these are just some headlines. Feel welcome to kind of skim at them while I read. They're all from the last couple of years. And I'm going to read a quote from a study real quick and then kind of close this out because I'm coming up on my time. Analysis of the emission from cars, SUVs, trucks, and buses show that exposure to harmful particulate matter air pollution is inequitable. And this is a United States study. So Asian Americans on average are exposed to 34% higher PM 2.5 concentrations than the average person in the US. Black people experience concentrations 24% higher than average. Latinos have 23% higher exposure than the US population as a whole. White people have average exposure that's 14% lower than average for the nation. That means on average, Asian Americans and Black people are exposed to PM 2.5 pollution that's 56 and 44% higher, respectively, than white people. So electrification is not just about cleaner technology, it's about health and it's about justice. EVs, as we know, don't have like tailpipe emissions, meaning immediate improvements in neighborhood air quality, where people live, where they work, where they play, where they worship, where they go to school. By reducing exposure to the most overburdened communities, electrification can help to close life expectancy gaps, health gaps, prevent hospitalizations, and overall just extend folks' lives. They could live long and healthy. More must be done to increase access to EVs and access to charging stations to ensure that this doesn't only benefit whiter and wealthier communities. So in short, and to kind of wrap this up, transitioning away from gas and diesel is one of the most direct ways to improve public health and to address inequities. Thank you.
Thank you. That was an awesome whirlwind tour through all this history. It's a lot of history to summarize, so thank you. I will move now, if my slides cooperate, into shifting from looking at the past to the future to see what this can all look like if we manage this transition as quickly as we'd like. I will take just a couple slides to do a quick comparison about EVs versus gas and diesel vehicles, because I hear a lot of confusion on this point. And to be fair, before we dove into this, didn't know a whole lot about this either. Often you hear, okay, an electric vehicle doesn't have a tailpipe, but what about brakes? What about tire wear? What about all that? So as Dr. Cohen mentioned earlier, there's lots of different pollutants that come out of internal combustion engines that harm human health. We're looking at particulate matter specifically for just a couple slides here because it is one of the biggest offenders. And so when you're thinking about vehicle pollution, there are two sources of particulate matter from vehicles. One is the exhaust pipe, so the actual combustion, the burning of the things. And then the other is non-exhaust. So that is mostly tire wear and brake wear, the actual friction of brakes rubbing against the wheel to slow it down, little particles peel off, and the same happens with tires on the road. EVs have no exhaust pipes, or pure battery electric vehicles have no exhaust pipes, so they don't have any exhaust particulate matter emissions. But for non-exhaust emissions, it does get more complicated. So electric vehicles in general are heavier than equivalent gas-powered cars, and so you can expect more particulate matter from tire and brake wear as a result. But at the same time, electric vehicles use regenerative braking, which is a method of braking that doesn't rely on friction. And so there's a lot less brake wear in electric vehicles. And so the question is, how do these things balance out? We found a study or a report from 2020 from the OECD that tabulates all the PM emission sources by vehicle type. So you've got the report has a lot of data. We put it into these graphs at the bottom, and I'm going to try and explain them in a way that makes sense because there's a lot on these slides. But basically, on the left we've got PM 2.5. On the right we've got PM 10. Everything that is blue is non-exhaust emissions, and everything that is orange is exhaust emissions. So I'm going to start on the very furthest left to walk through one example here. So PC stands for passenger car, SUV is an SUV, and then LCV is a light commercial vehicle. And then what this report did was look at, for each of those categories of vehicles, it looked at diesel vehicles, gas vehicles, and then two types of battery electric vehicles, or BEVs, one with a range of 100 kilometers and one with a range of 300 kilometers. And so you can see here that for the passenger vehicles, the low end of the estimate, the diesel and gas emissions of particulate matter are higher than the battery electric that gets 100 miles and the battery electric that gets 300 miles. And for every single category of vehicle and for every single type of emission, when you add the exhaust and non-exhaust emissions of the gas or diesel vehicle, they are always higher than the non-exhaust emissions of the battery electric vehicle. So this is a slide for the nerds. If you want to dive into this, we've got a whole blog post that picks this apart. But the story here is that the fact that the vehicles don't have an exhaust pipe and use regenerative braking overcomes the fact that they're heavier and might therefore otherwise create more particulate matter. This is shown in this study, but also borne out by two recent real-world studies that we like to point to. One is by the Keck School of Medicine over in California that compared real-life EV registration data, air quality data. They looked at nitrogen oxides instead of particulate matter, and asthma-related ER visits in California between 2013 and 2019. And they adjusted for other factors to pull out the trend. But what they showed was as EV adoption increases, asthma-related emergency room visits drop. So that's really exciting to see that real world data. And then very recently, EIT Urban Mobility, which is affiliated with the European Union, released a study just this summer that found that in the major cities they studied, the increase in electric vehicles reduced particulate matter by over 80%. So these are really exciting real world, real life stories that I think set us up well for the next slides, which are from Dan to talk about, okay, let's model this out. If we go electric, what does that actually mean in the future? So Dan, take it away.
Thank you. Before I jump in, I saw Caroline put in the chat. Did you want to answer that question before I jump into my slides?
I think let's do your slides and then
we'll come back.
Let's go back.
Awesome. Well, hi, everyone. Once again, my name is Dan Fitzgerald. I oversee our advocacy and public policy work for in Rhode Island and Massachusetts for the American Lung Association. Ultimately, all of our work is working to create a world free of lung disease. So we really put our mission into kind of four main areas: defeating lung cancer and other lung diseases, creating a tobacco-free future, access to quality and affordable healthcare. And what I'll be talking about today is some of our work in the Champion Healthy Air for All, and really building off of exactly what Dr. Cohen and what Alyssa talked about. I wanted to share a little bit about some of our recent research reports that hopefully could be a tool for you all in all of our collective advocacy of moving this important work forward. So on the next slide, I want to quickly talk about our the state of the air report. This 2025 data came out. This is our 26th annual state of the air report, and ultimately it is looking at unhealthy levels of air pollution for ground level ozone and both short-term and long-term particle pollution. So I won't go too deep into this, as a lot of this we kind of just talked about, a lot of the information that Alyssa shared about, and as well as the public health or health impact that Dr. Cohen did. But I did want to share that this is a great tool. We put this report out every April. You can look at this both at a county or a state level and also at a metropolitan level. I highlighted just some quick data there at the bottom from the Boston, Worcester, Providence metropolitan area that actually found that our metro area was ranked 61st worst for high ozone days. And there's a tremendous amount of data as a part of this. The report can be a great way to, ultimately dive into data at that higher level, but also can be used as a tool to talk about and looking at the impact from things like ozone. We talk about that as a sunburn of the lungs. We can look at really to what Alyssa was talking about, of thinking we see some of the highest rates of asthma in areas close to, same what she was talking about in Boston, in Providence, between the Port of Providence and the 95 corridor. So looking at a lot of that data to help fuel the work that we do. But the main reports I wanted to talk about today, on the next slide, we have 4 individual reports that all kind of work together, looking at the public health impact of zero emission vehicles powered by renewable energy. So our newest one in this category of research reports is called Boosting Health for Children. It's looking at specifically the pediatric impact of zero emission transportation. We have one that's very specific to, it's called Driving to Clean Air. So looking at the health benefits of zero emission cars specifically. We have one that is on trucks and transportation and outside of kind of the residential transportation space. And then our culmination that I'll talk a little bit more about that is our zeroing in on healthy air report that looks at the health and climate benefits of zero emission vehicles, and what that could look like over time. So on the next slide, I'll share just a little bit about that report here. The zeroing in on healthy air report that looks at a rapid transition to zero emission transportation powered by renewable energy would result by 2050 in $1.2 trillion in public health benefits. That's trillion with a T. This is a very long report that I'm only going to really touch the really high levels of. So I have the link towards the end of my slides, and I would love for you to dive into it and hopefully use this as a tool, but really looking at this as a way to achieve major benefits to our health and our climate. And then on the next slide, I wanted to quickly talk about some of the impacts that this report found here in our metro area and the Boston Providence area. We were actually on the top 25 lists of the cities that would, or metro areas that would have the biggest public health benefit from this rapid transition to zero emission vehicles, for many of the reasons that Alyssa talked about, of looking at and you can see some more of this in our state of the air report, but we know that this burden is not shared equally. And we found that because of that, we see a lot of this bigger impact in our Boston and Providence area. So more specifically, the cumulative public health benefit for this transition by 2050 would be about $22.7 billion. We could also avoid over 2,000 premature deaths, 43,000 asthma attacks avoided, and over 230,000 work lost days avoided as well. So we know that to do this is a culmination of health and climate and residents working together on our advocacy. So we hope that these tools can be a helpful way for folks to use this data to talk about this from a health perspective, in addition to the great work that you all are already doing. And on my last slide here, before we jump into questions, I just wanted to share that you can find this at lung.org/EV, or if you're interested in our state of the air report, lung.org/SOTA. If there is ways that we can help utilize this data or package it in a different way that would help in your own advocacy, please reach out. My email's right there. And if you're ever interested in hearing from the Lung Association on our advocacy in Rhode Island and Mass or across the nation, you can join our Lung Action Network. You can simply text LAN to 34727, and you'll hear from us and be engaged in our advocacy. But yeah, thank you so much for having me, and hopefully these research reports can be helpful for you moving forward.
Well, thank you. I'm going to transition us to a discussion. I know we've got a couple questions already. I will say to everybody on the webinar, please submit your questions. We definitely want to get to them all. You can do that with the Q&A at the bottom of your Zoom screen. But if you'd like to contact any of us after the webinar individually, you can do that there, and we'll send out those emails in the follow-up email as well. So for now, I'm going to stop sharing my screen just so that we can all see each other and get to some of these questions. One question, which is a good one that we get a lot, which any of you are welcome to answer, is what about the harmful battery manufacturing process for EVs? Do any of you want to comment on that?
I can talk if you want.
Yeah, please.
I think there are a couple things. First of all, the manufacture of batteries requires a lot of energy up front, as well as a lot of water. That's true also of all the AI stuff that's going on now. A lot of water is required for cooling. In this case, the water is used for extraction and purification of the minerals. The total amount of energy required, or greenhouse gas emission, or however you want to measure it, over the life of a car, there's more upfront with the manufacturing EV compared to gas, and then a lot less over the life of the car. So the total amount is greater with a gas car. I think that the biggest concern is the water use, and then all of the safety, child labor concerns about mining in a lot of countries where cobalt and lithium are being mined. I think cobalt is mostly in DRC, in Democratic Republic of Congo, and there are concerns about the safety, exposure to toxins, slave labor, child labor. So I think those things are definite concerns. I don't want to minimize those at all. I think, the other thing about batteries, though, is that they're more effectively being recycled, and the minerals are purified and reused. So definite concerns. In terms of the energy calculation, though, I think it's pretty clear that EVs use less. Again, you have to assume that the grid is going to be more and more electrified as time goes on. I think many people see that that's kind of an inevitable thing that's going to need to happen for us to reduce emissions. But if you account for that, the overall amount of emissions that are used would definitely be less with the electric car.
Alyssa or Dan, do you want to add anything to that? I'll add one thing, which is often when people ask us about the battery manufacturing process, they're asking from a greenhouse gas emissions perspective. From a public health perspective, I will say that where we have kind of landed is that I don't know of any mining or industrial process anywhere in the world that does not have social or environmental impacts that are negative. I think what is clear in a fossil fuel-based economy is that we have to continually pull fossil fuels out of the ground forever. Whereas with the vision that the American Lung Association's reports build out of an electrified future running on renewable energy, there's some amount of mining, but then that recycling piece kicks in and you don't have to keep pulling stuff out of the earth at the same scale. There's been some interesting studies that I can also share of just the sheer amount of tonnage of stuff that we have to pull out of the ground in a fossil fuel-based economy is so much more than one that's based on renewable energy. So I want to second what Dr. Cohen said about there are concerns there that absolutely need to be addressed for sure. Go ahead, Alyssa.
That did spark a thought that I have. So for those of you who have a little bit of a public health understanding, you might have heard of the social determinants of health, and there's the areas where we live, work, and play, and how that has an impact on our health. We're thinking about access to food, access to healthcare, jobs, employment, et cetera, et cetera. there's something that's a newer term that was coined, I believe, 2022, 2023, formerly here in the United States. It's something that's been used globally now for several years, and it's called the commercial determinants of health. And it's how businesses and corporations, especially multinational corporations, have an ability to positively or negatively impact our health, us being society, people. And so we think about the social and environmental impacts of things like mining and those concerns, which are very real and very present. We think we have to think about these corporations as actors, and how can we influence actors and politicians and heads of state to do things that will positively impact people's health versus negatively. So there are social determinants of health at play, political determinants of health at play. There's also commercial determinants of health, and how do we, like I said, influence and address the actions of corporations and try to change those to better the health of the people who are doing work in other places, as well as the health of people who are trying to be like recipients of those things, like us buying EVs.
There's a comment from an EV driver here that I appreciate, which is just a reminder to folks who have EVs, is that the brake and tire particulates are pretty under the control of the EV driver. If you don't slam on the brakes and slam on the accelerator all the time, you will produce fewer particulates and other emissions than if you drive really aggressively. So thank you, Jim, for that reminder. I have one question. There's two more questions for now. One is, do you have any information about the air pollution levels generated by gas stations? And I'm wondering if Dr. Cohen or Dan or Alyssa, do any of you have knowledge there? Because I actually don't. I imagine it's not good, but please enlighten us.
I can jump in. I can definitely follow up with some more specific. I don't have the exact data in front of me, but I do know that gas stations certainly contribute to air pollution and pollutants like volatile organic compounds. So that we have some research around that, but I think it also just gets back to what Alyssa was talking about as we look at the burden is not shared equally, and as we look at the composition of neighborhoods and where pollutants come from, both from gas stations here, but also from other sources of pollution to the ports and the highways that we've talked about. All of those absolutely contribute to, and one of the things we talk about here at the Lung Association, one of the leading indicators of health is the very zip code you live in. And that would certainly makes an impact. But happy to try to find I can see if I can do it while we're still on. See if I can find something.
I just looked a little bit as well, and it looks like benzene, which is a carcinogen that is in the air around gas stations, is associated with an increased risk of pediatric leukemia. So I think that would be one. But then all of the VOCs, all the volatile organic compounds, have a lot of health impacts and known health impacts. Yeah.
Another sort of sciencey question here is, we sort of talked about gas and diesel in one breath for most of this webinar, but they are very different. So the question is specifically about kids sitting on a school bus, which I know there's been a big campaign to electrify school buses for a long time, but could you respond to the kids sitting on a school bus and also diesel versus gasoline? Any of you?
Well, I mean, I will have to do a little looking up at the same time. My understanding is that diesel's is worse. I mean, also just it's usually the smell is more potent, and that usually is a sign that there are more volatile organic compounds. Just in doing a quick search, it looks like both particulate matter that are very small, ultra fine, and nitrogen oxides are higher. So definitely, I think exposure to diesel is worse. I think the question is there anything else you can do to prevent kids from being exposed to it? And I mean, and again, I'm absolutely not an expert in this area, but I think idling, people talk a lot about just having trucks idling in a location, or a lot of people leave their cars running or bus, and then that is definitely really problematic. And I think in most cases not necessary unless you're in a really cold day or other things. And of course, EVs can heat, or can heat the vehicle without resorting to having anything combusting, which is a nice feature. The other thing I don't know anything about is whether there's been any attempt to, have what the filtration is on these on school buses, but that would be a cheaper and shorter term solution if that's not already being done. I mean, most of the time the windows are not open in the Northeast, I would imagine, anyways. So.
I will say, the Union of Concerned Scientists, I think it is, did a study a couple years ago looking at relative emissions from different types of vehicles, and they found that vehicles from class 2B to class 8, so basically everything from like a transit van up to a one of those combo trucks, basically, make up 6% of the vehicles on the road in southern New England. And most of these run on diesel, but they're responsible for 48% of the nitrogen emissions and 41% of the particulate matter emissions from the transportation sector. So diesel-powered vehicles do absolutely disproportionately cause this type of pollution, which is why ports in particular are such a big center for this kind of pollution, because you've got both the ships coming in and the heavy-duty trucks coming in, and they're all running on diesel. I'll also say on the school bus front that there's a lot of work that's been done. The World Resources Institute has had a campaign on electric school buses for a long time. And it is frightening how many of those particulates seep into the buses when those buses are idling or driving, and there's data showing impact on that in terms of the kids' cognition when they get to school. So those diesel's bad. This is my long story short answer.
Can I circle back to the question that was asked previously?
Absolutely.
Because I was still thinking about it as it relates to like the gas station thing. And I'm very worried about gas stations. I don't have that data in front of me, but what worries me more is living close to mechanic shops and like auto body shops because of oil and gas and runoff and the materials from those places. There's not only fumes, but it also gets into soil. And that soil, kids play in soil, it travels, it goes in rainwater, it goes down the street. And so that could just be another thing to be concerned about as it relates to, when you have a gas vehicle versus like oil vehicles. Electric vehicles don't necessarily need oil changes, gas, things of that nature that required related to combustion.
The questions are coming in, so I'm
I
gonna.
I can take a stab at if you guys want at the next one.
Yeah, go for it.
So EV charging stations.
Wait, first say what the question is.
Yeah. Are the health impacts of EV charging stations known? I think they're pretty. Again, I'm looking things up on the fly because I don't know the answer. The electric vehicle charging stations use DC current, and there is a if you've been to them or not been to them, I'm not even sure. There's the noise is not significant at all. That is one theoretical concern. Again, a lot less probably than being than gas cars and so forth. And the cooling fans that are used for the DC current can resuspend particulate matter, but don't generate particulate matter. So if it's settling down, it can sort of send it back into the air. And then there's a lot of controversy about electromagnetic fields in general. However, from a medical perspective, DC current does not generate, it generates a 0 hertz field, which is not a field that does anything. So even there's a lot of controversy about electromagnetic fields and if they do anything negative. And I think there's any solid evidence on that. But DC fields literally do not generate any frequencies. So they don't probably have any health impact.
Thank you. I also saw there's a couple studies that came out, or it's really one study that's been reported on about PM levels at DC fast charging stations in California. And that was exactly that issue. Basically, there's the fans resuspending some of the particulates. You touched on noise very briefly, but somebody actually asked if anybody's commented on the effects of noise pollution and public health benefits on that front.
I would only say that when I bring my kids to a trampoline park after like an hour, like I'm very overstimulated and unhappy. So, and I think people can comment on what's their experience of being deep in a forest when there's no noise and how they feel. Definitely, I think being exposed to noise chronically. I haven't done any research at the moment about this, but can make you feel chronically stressed, like living in a city in a lot of ways can, and that absolutely has negative health impacts. Yeah.
And this is not from the Lung Association perspective, but I know the our partners at the American Public Health Association have some great information about noise as a public health hazard. So I know they have some great stuff. I'm not sure about in Massachusetts. I know there's some local orgs in Rhode Island who are doing some cool work about mapping out noise, and others mapping out smell. Like, so all these other aspects of related there. But definitely check out the Public Health Association. They have some great stuff.
I just want to second and third that noise leading to chronic stress, and that contributes to chronic illness, as many things do, but noise is harmful. I believe it also impacts learning. Not my area of expertise per se, but I've heard it impacts, heard in a public health way, not like I heard on the street, that it also impacts learning for, especially for young kids.
That makes a lot of sense. We have one question about whether electrifying passenger vehicles or public transit vehicles has a greater impact on reducing PM emissions. I have a way that I'd respond to that, but I definitely want to hear from you guys first.
Oh, Dan, go ahead. Yeah.
I was gonna say I could not find the mute button. Sorry about that. It's all kind of compiled up into the zeroing in on healthy air report that I talked about. But we do have a separate report on the passenger vehicles versus public and trucking. So what we found in the trucking report, they're pretty comparable, but it was slightly higher for the passenger car area is where we saw a larger benefit in those kind of four metrics. In the public health benefits from like a fiscal component, avoided premature deaths, asthma attacks, and lost work days. But yeah, interested in how others would respond too.
I definitely think electrifying public buses would be huge. Yeah. And subway for that matter. To the advantage of I'm gonna some buses in already, right, run on electric lines in Boston. Yeah. But yeah, just because you're first of all you're immediately targeting urban noise and environmental pollution. And you're think about in theory how many cars these people would be driving. Of course, Americans on the other side of it, are we going to get there without targeting cars? Probably not, because most Americans don't take public transportation. So I would say it kind of needs to be a dual effort. But I do think cities could do a lot.
Electrification would definitely help. And electrification is one of BECMA's, underneath our clean energy environmental justice bucket, one of our top priorities. Part of the commuter rail in Boston has also been electrified. Electrified, the Fairmont line, or the Purple line.
It's in the process of being electrified.
In the process of being electrified. I went to the little ceremony thing. So in my mind, it already happened, but you're right, it did not. So that's just something I think folks from an advocacy perspective will continue to fight for, is as much as can be electrified, let's do it.
And then I'd say keep the questions coming, but there's one here that I think is a nice rounding us out question, which is, what do successful policies to promote EV adoption look like to you? What is important to consider or include?
I'm happy to jump in here. I mean, I think the work that we're doing is multi-pronged here, but ultimately, obviously, going in anything to get us in the direction of that future that we were just talking about, both from the rapid transition to zero emission vehicles, and that's multi-pronged, right? Making sure that is not cost prohibited, making sure that is something that can be equitably rolled out and beneficial for all, especially looking at the disproportionate burden of who's taking on the most health harms from emissions, but also on the renewable energy front. So that a lot of our policy areas are kind of in both areas there of looking at ways to boost up renewable energy, but also make sure that we're eliminating root causes of environmental injustices and that looks a lot of different ways. I know we were talking a lot about electric buses just a moment ago. We have a tremendous amount of resources, policy tools and videos and things in that way too, if there's folks working on in that area that we could help with as well.
I think it has to be, I think people will make the change when it's for selfish reasons, unfortunately. I think economic incentives, and I think it has to really be it has to be obvious that electric vehicles are cheaper in the long term, and maybe even upfront too, although I don't think that's going to be the case probably for a long time or at all. And I think gas, probably when gas prices are, or if and when they're much higher, I think that that'll be more motivating for people too. And then I think we all have to agree that this is a problem in the first place, and that's not the case either. So, but I think economic incentives really have to be the biggest thing. I have 2 electric cars, but before that I was happily driving like a Honda Civic, which is very efficient. But I didn't get the electric cars for financial reasons. I did it because I felt very strongly about it. So, and not everyone has that luxury.
I would say, in addition to what's been said, because I agree with both Dan and Dr. Cohen, I think about, where can government try to influence buyer behavior? It could be through economic persuasion. It also could be around leading the charge, like electrifying public fleets. And when there's public procurement opportunities, going with an electric option, I do think they have the ability to influence the industry and several industries towards electrification. And that might also influence consumers. So on a completely non-public health note, I also think we have to make it cool. Because a lot of things, if they're not cool, people just don't buy in. And cool is subjective, but sometimes we got to make things cool.
That. I'll say
I was going to say that must be an electric motorcycle that makes a really, really loud noise when you is that the only solution to cool? I don't know.
I don't know. We got to keep figuring out the cool factor.
We got to get some biker gangs interested.
Oh, they're out there. Believe me, they come to our EV events.
Okay.
I'll just say that I think with EV and EVs and policy, the challenge is balancing the move forward as fast as possible and make sure that the benefits are distributed equitably. So if you've got a pot of money, how much of it goes towards general incentives to go electric or increased incentives for low-income families? So that's always the conversation to be had. I think we as Green Energy Consumers Alliance are focusing on purchase incentives, yes, but also the build out of charging infrastructure and electric rates and how those are set. Because there's a lot that can be done to make the economic case a little better or the convenience case a little better. That doesn't necessarily mean a direct purchase incentive, which with the loss of the federal tax credit is a harder case to make right now. We've got 5 minutes left, and there's one question. Somebody asked if you could speak more on the concentration of particulate matter along major transportation routes, considering we see less people of color in suburbs, but they are still connected to cities with highways. I'm not sure, Alyssa, if that did. I think I read that weirdly. Did the question make sense to you? Do you want to comment on that?
Yeah, the question makes sense to me. I think it's more, I grew up in Peabody, which is near a highway, but also is a suburb. And when we think about the location of the highway and the distance between the highway and where residential like homes are, it's much further apart than when we're in major cities and stacked on top of each other. I think about density in communities and suburbs, they're just less dense. We have a lot more standing single family homes with plenty of land, much more trees, and just more distance from highways, major highways. And then when we live in cities, we have multifamily housing, triple deckers, just the density is so much higher and we're so much closer to these truck routes that I do think the impact is a little bit different. I'd be curious to do more research as it relates to suburbs, potentially, further out in Central and West Mass, and how the level of particulate pollution is impacting suburbs, just given the distance and the density to the truck routes.
I also think trees are might be a big factor too. So if you have
Mhm.
if you have like, many towns in Massachusetts have pretty big swaths of forest or town parks or, town forests and things like that. Like the Middlesex Falls. I mean, just huge areas of trees. I'm sure that has a big impact too.
That's a great point. And a lot of suburbs have conservation land or land they've just set aside that can't be developed. Whereas here in cities, we don't have trees. Yes, there are some parks and like things the city of Boston in particular tries to do to create green space, but naturally there are fewer trees, which also leads to like hotter climates and other health issues, like a whole separate conversation.
Yep.
And so, like I said, trees, density, distance, there's more that can be discussed there, and I would have to really look into that.
Well, I will say thank you very much to both of you. We seem to have lost Dan, but I thank Dan as well. And I thank all of you who've joined us and asked really good questions. There were more questions than we could get to. There are a couple on specifically we have to clean up our electricity grid as we're doing all this. We could have a whole other webinar on how we're doing that. There's state policies in place in both Massachusetts and Rhode Island that require more renewable energy to be added each year. A bunch of questions about school buses. That's a whole can of worms that we're happy to talk about. That's very complicated, particularly in our region. But because it's almost 1 o'clock, I will return to the slides just again to say, if you do have any follow-up questions, you are welcome to send any of us an email. We'll also send out a recording with the slides and all of our email addresses. And then I am contractually obliged to remind everybody that we are a nonprofit organization, and we want to keep putting on free educational series like this. So if you are so inclined and able, we will always welcome a donation at greenenergyconsumers.org/give, or give now, sorry. But with that, I'll say a big thanks to Alyssa, Dr. Cohen, and Dan, wherever he went. Thank you for joining us, and I hope you all get to go outside and enjoy the lovely weather.
Thank you so much.
Thanks so much.
Bye.
Bye.